Hey guys, Mike here from nursing.com's YouTube channel. And today we're going to talk about 8 things that you need to know about the NCLEX before you take the NCLEX. All right, let's get into it. All right, so the first thing you got to know is the NCLEX of the past was multiple choice, period. It was, here's a question, here's your answers, and then, the select all that apply or first and last and all that. That was all there. The test is changing, and now we have next-gen question types. And I'll be honest, I'm not the expert on these, but I do know what some of them are. So we have things like multiple response and matrix questions and highlight questions, drop-down menus for questions, drag and drop items, bow tie items, and trending items. Now, that brings me to number 2. If you want to really get a handle on what these things are, I want you to go and I want you to find this. This is the introduction to NextGen, and this actually breaks down all of the question categories and kind of explains to you what's in them and how you can answer them. Once you get to that, we go to number 3, where I want you to look at NextGen item examples. That is also on the website. You can search for that, and this is going to kind of lay out how these questions are laid out. It's going to give you some examples of the questions so you can see how to answer them. Once you've kind of done that on nursing.com or even before, it's really up to you. How you guys do things is up to you. These are just suggestions. But you do want to download this. This is on the NCSBN website. These are the guys who make the NCLEX. This is the test plan. Download this. I'm telling you. This, you can see it. It's not thin. I think it's 50-something pages, 60 pages. This has everything you're going to need to know about the exam itself. Now, it does have some examples in there. It does break down what the questions look like. NCLEX made that. So, take that with a grain of salt. It's what they want you to know. Nursing.com, our website, is going to break down things a little further, but you do want to look at that test plan. Trust me. Number 5, let's go over some numbers. All right. So the test, minimum of 85 questions. It used to be 75. Now it's 85. All right. 150 max. Okay. The way that the test is graded, it's there's some sort of algorithm behind it. I don't know. As you take the questions, the test is determining basically if you can pass. So if you answer 10 questions right and 1 wrong, and the next 10 right and the next 1 wrong, it's going to let you pass. But if you get like the first 30 questions wrong, which trust me, you would never do. You guys are awesome. But if you did, you wouldn't pass. It would know that it's going to use an average and it's going to say you're not going to pass. But that's okay. You have 5 hours to take the test. That is a long time. Okay? Don't stress about time. 5 hours for 150 questions, if you even get that many, that's cake. That allows you to not stress. Trust me. You're going to have 3 case studies with 6 items each. Okay? There are 8 category testing areas, and we did get into, I don't know yet. But this is definitely another video where we kind of get into the category areas. We get into a little bit of which ones you should know, and then we actually go into all of them and break down the menus and tell you what's in them. But we have physiological adaptation, management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, pharmacological and parenteral therapies, and reduction of risk potential. It sounds like a lot, but this is stuff you guys know. They're just wording it very specifically to kind of freak you out a little bit. But you know all this stuff. Management of care, hello, that's what we do. We're nurses. All right, number 6. A little bit about the next-gen totals. All right, so we have the 3 case studies with 6 accompanying questions for each case study. Then we have 7 next-gen standalone items, and that's some of the stuff I talked about earlier. The case studies I like because they allow you to sort of put into practice your knowledge. It says, well, your patient comes in with an ST elevation MI. What are the steps? Well, we get an EKG, we put in an IV, we give them oxygen, we give them aspirin. You follow that level of knowledge towards the disease process. So I like the case studies. Number 7, a little bit of information. So you're going to get next-gen questions, and they're based on the EMR, right? And or the EHR, however you want to say it, the health record, right? And what it's going to base it on is it's going to go over the nurse's note, the history and physical, the H&P, lab results, flow sheets, orders, and diagnostics like radiology. It's going to go through all of that information. You're going to have to go through that to pull out some of your answers. All right? Sounds harder than it is. Trust me. And if you've done clinicals or if you've done any work in school, you've gone into health records. You know where to find stuff. This is going to be a little easier to find because it's going to kind of point you in a direction as opposed to kind of hunting around when you go to clinicals and you don't know the EMR. It's going to be a little easier here. And then the last one, the thing that we want you to know is, so the NextGen questions, they're based on what's called the Nursing Clinical Judgment Measurement Model. A lot of words. Thankfully, nursing.com has made that for you. I'm always backwards with this. Sorry, guys. But basically, what the clinical judgment measurement model has, there are 6 cognitive skills that they test on, and it's recognizing cues, analyzing cues, prioritizing hypothesis, generating solutions, taking actions, and evaluating outcomes. This is easy, man. This is what we do. This is kind of like what you've done with your care plans, right? So recognize cues. What are my signs and symptoms? Analyze cues. What do my signs and symptoms mean? Prioritize hypothesis. Give me a differential diagnosis, right? Generate solutions. Now I got my diagnosis. What am I supposed to do about it? What are my treatment options? Take action. Hello? Take the actions. Give the meds. Do the care. Fluff the pillows. And then evaluate the outcomes. I gave pain meds. What was my response? Okay? This stuff is easy. And this is how NCLEX tests. That is what they base everything off of. All right? You will all pass the test. Just get a handle on it, understand what you're getting into, and you'll be fine. All right, guys, there are your 8 tips. I'll see you on the next one. Hey, guys. So I hope this video helps you in your nursing journey. Now go out, be your best self today, and as always, happy nursing.